In medical news, an important story that could help most of the 180,000 men that are diagnosed with prostate cancer each year.
And this evening, Dr. Jay Adlersberg shows us a new tool that can help patients decide which treatment is best for them. It's a big decision. Jay?
Rob and Roz, that it's a cancer that doesn't have one best treatment, so men are faced with 2, 3, sometimes even 4 choices of how to manage a scary disease with worrisome treatment side effects. Some local researchers have a way to ease a man's indecision. This must have been a very difficult decision to make.
Very, very difficult decision, yes. Very frightening.
58-year-old Ed Grossman has prostate cancer. Ed had to choose a treatment: surgery to remove the gland, external radiation, or radioactive seed implants. His reaction?
Terribly confused. I mean, how would I know the difference between radiation, seed implantation, a combination of those two, or radical surgery?
This chart was designed as a tool to help Ed and other patients make the call.
What we're trying to provide the patient is a suite of tools that give him predictions for each of the common treatment choices.
The chart, called a nomogram, predicts the odds that a man will be cancer-free in 5 years. There's one chart for surgery and one for radiation. Doctors simply plug in a patient's data. Take this patient, for example. His PSA blood test for the cancer was 10. His Gleason score, how likely the cancer is to grow fast and spread, was 8. Doctors get that score from the prostate biopsy. Lastly, he would get no hormones to shrink the tumor before treatment. With other data added in, the nomograms predict surgery would give him a 63 to 83% chance of a 5-year cure. But radiation gives this man a 73 to 93% chance. But there's more to making a decision about radiation versus surgery than simply the odds of success with each method. The big issue for Ed was quality of life. Ed's odds for both treatments were equal. He chose radiation, which results in less impotence and incontinence.
I still have an active sex life, and I certainly don't want any problems with urination. I picked the therapy that would give me the least amount of side effects.
The nomogram predictions come within 10% of the actual 5-year cure rates for each treatment. In the pipeline are nomograms for seed implants combined with radiation and for other therapy options. Roswell.
You know, Jay, we watched Mayor Giuliani go through this decision process. How much time does a man generally have to make the decision?
That's an important question, Rob. Generally, a man has somewhere between 3 and 5 months even to make a decision, because prostate cancer is a relatively slow-growing cancer, and men have a bit of time to evaluate all the potential options.
Certainly. Yeah, that's good to hear. All right.